5 medical checkups I would never get after 60. Imagine you walk into your doctor's office at age 65. You feel fine, you're walking normally, you're eating normally, you're sleeping reasonably well, you don't have any major symptoms, and then your doctor says, "Let's run a few tests just to make sure everything is okay." Sounds harmless, right? After all, who doesn't want to know that everything is okay? But here's the question most people never ask. What happens when the test finds something that wasn't actually a problem? Because sometimes the test doesn't end the story. It starts one abnormal number, then another test, then a scan, then a specialist, then maybe a biopsy. And suddenly, you're spending weeks worrying about a disease you may never have developed in the first place. That's why today we're talking about 5 medical checkups I would personally think twice about after 60. Not because doctors are trying to hurt you, not because medical tests are bad, and definitely not because you should stop seeing your doctor. The real issue is much more interesting. Sometimes the smartest medical decision isn't doing more, it's knowing when more isn't necessary. And wait until you hear number 1, because this is the mistake I see people making again and again. Number 5, the just to be safe whole body scan. Let's start with one of the most tempting ideas in modern medicine, a complete scan of your body. Your head, your chest, your abdomen, your pelvis, everything. The sales pitch sounds amazing. We'll look inside your body and see if there's anything wrong before you even have symptoms. For someone over 60, that can sound like the perfect insurance policy. But here's the problem. Your body is complicated, and when you look hard enough, you will find things. Small cysts, tiny nodules, benign growths, incidental findings, minor abnormalities. Things that may have been sitting inside your body for decades without causing a single problem. And now you've found them. So naturally, you ask, "Doctor, what is that?" And that's where the story can change. Maybe your doctor says, "We're not sure." Now you need another scan. Maybe the second scan says, "We should take a closer look." Now you see a specialist. Maybe the specialist recommends a biopsy. And suddenly, something that started as, "Let's just make sure you're healthy," has become, "Let's figure out whether this is cancer." Imagine going through weeks of anxiety, waiting for appointments, waiting for results, waiting for someone to tell you whether the thing they discovered is dangerous. And then you find out it was harmless. That's called an incidental finding. And it's one reason the question, "Can we scan everything?" isn't necessarily the same as, "Can we improve my health?" Now, let's be very clear. If you have symptoms, if your doctor feels something concerning, if you have a history of cancer, or if there's a specific medical reason to order imaging, that's completely different. A targeted scan can be extremely valuable. The issue is scanning healthy people without a clear reason simply because technology makes it possible. So if somebody offers you a whole body scan just to be safe, ask, what exactly are we looking for, and what would we do if we found something? That one question could save you a lot of anxiety. Number 4, the test you keep doing because I've always done it. This one is much more common, and honestly, it's understandable. You started a screening test years ago. Maybe you did it at 50, then 55, then 60, then 65. And eventually, nobody even discusses whether you still need it. You just keep doing it, because I've always done it. But here's something important about medical screening. The right test at one age isn't automatically the right test forever. As you get older, the balance between benefits and risks can change. Let's take colorectal cancer screening as an example. The USPSTF strongly recommends screening adults from 50 to 75. But for adults aged 76 to 85, the decision becomes individualized. Why? Because your overall health matters, your previous screening history matters, your life expectancy matters. and the possible harms of certain procedures can increase with age. So imagine two people. Both are 80 years old. Person A is extremely healthy, active, and has never been screened. Person B has been screened regularly for decades and has multiple serious health problems. Should they automatically receive exactly the same screening? Of course not. Their situations are completely different. And that's the point. After 60, you shouldn't simply ask, what tests do people my age get? Ask, what tests make sense for someone with my health history? That's a much smarter question, because medicine isn't supposed to be one size fits all. Number 3, the test that looks for a problem you don't actually have. Now we're getting into something fascinating. There's a difference between screening and diagnosis. If you have symptoms, your doctor may investigate those symptoms. That's diagnosis. But if you're perfectly healthy and have no symptoms, testing you for a disease is screening. And screening can be extremely valuable when the evidence shows that it helps people live longer or healthier lives. But not every available test has been proven useful for every person. This is where people sometimes get confused. They think, if there's a test for it, why wouldn't I take it? Because a test can produce information without producing a benefit. Let me give you a simple example. Imagine there's a test that can detect a tiny abnormality. Sounds great, but suppose doctors don't know whether that abnormality will ever cause you harm. Now what? You may become worried. You may need additional testing, and additional testing can sometimes lead to invasive procedures. So the question isn't, can we detect it? The question is, does detecting it early actually help people like me? That's a completely different question. And this is especially important with some types of screening in older adults. For example, the USPSTF currently says there isn't enough evidence to determine whether routine screening for cognitive impairment in asymptomatic adults 65 and older provides more benefit than harm. That does not mean memory problems should be ignored. Quite the opposite. If you're noticing significant memory changes, getting lost, forgetting important information, struggling with everyday tasks, or your family notices a major change, you should absolutely talk to a healthcare professional. But that's different from testing every symptom-free person simply because they turned 65. And that distinction is incredibly important. Number 2, the blood test that scares you with one number. Now let's talk about something almost everybody has experienced. You get your blood work. The doctor looks at the results. Most of the numbers look fine, but one number is highlighted. Maybe it's slightly high, maybe it's slightly low, and suddenly you see a word like abnormal. Your heart drops. You start Googling, and within 5 minutes, you're convinced you have 3 diseases and 6 months to live. Please, don't do that. One abnormal laboratory value does not automatically mean you have a serious disease. Reference ranges are not magic lines separating healthy from sick. Laboratory values can be influenced by many factors: your medications, your hydration, recent illness, exercise, diet, timing, age, and your individual medical history. That's why doctors don't normally diagnose an entire disease based on one slightly abnormal number. They look at the bigger picture. They may compare today's result with your previous results. They may repeat the test. They may ask whether you're having symptoms. They may review your medications. They may simply decide that the result isn't clinically important. And this is why I would never panic over one mildly abnormal result. Instead, I'd ask, how important is this result in the context of my overall health? That's a much better question, because the goal isn't to make every number look perfect. The goal is to improve your health, and those aren't always the same thing. Number 1, the PSA test after 70, without a real discussion. Now let's talk about the test that causes one of the biggest misunderstandings among older men, the PSA test. PSA stands for prostate-specific antigen. It's a blood test that can help detect prostate cancer. And prostate cancer is obviously a serious disease. So you might think, why wouldn't every older man want to keep checking? Here's where things get complicated. The USPSTF recommends against routine PSA-based prostate cancer screening in men aged 70 and older. Why? Because the potential benefits of finding prostate cancer through screening may take years to appear, while the harms from false positives, biopsies, overdiagnosis, and treatment can happen much sooner. And this is the part many people don't understand. Not every prostate cancer behaves aggressively. Some prostate cancers grow so slowly that they may never cause serious problems during a man's lifetime. But if screening discovers one, what happens? You might have more testing. You might have a biopsy.
And if cancer is found, you may be faced with difficult decisions about treatment. Some treatments can cause problems such as urinary incontinence or sexual dysfunction. So suddenly, you're treating a cancer that might never have become dangerous. That's the problem of overdiagnosis and overtreatment. Now, this does not mean men over 70 should never talk about prostate cancer. Absolutely not. If you have symptoms, if you have a strong family history, if you've had previous abnormal results, or if you have other significant risk factors, your situation may be different. And some men may still decide to pursue testing after discussing the benefits and risks with their doctor. The key is informed decision-making, not fear, not routine, not "I've always had my PSA checked," but given my age, health, history, and preferences, does this test still make sense for me? That is the conversation worth having. But here's the big surprise. So far, I've given you 5 tests or testing situations to think twice about. But here's something I don't want you to misunderstand. I'm not saying after 60, stop getting medical checkups. That would be terrible advice. In fact, some preventative care becomes even more important as you get older. For example, osteoporosis screening can be important. The current USPSTF recommendation is to screen women 65 and older for osteoporosis. For men, however, the evidence is currently considered insufficient to determine the balance of benefits and harms for routine screening. That's a perfect example of why you can't simply say, everyone over 60 should get this, or nobody over 60 should get this. Real medicine is more complicated, and that's okay, because your goal isn't to memorize a list of tests. Your goal is to learn how to have a better conversation with your doctor. The 5 questions I want you to write down. Before your next appointment, save these questions on your phone. Seriously, write them down. Because when you're sitting in a doctor's office, it's easy to forget what you wanted to ask. Question 1, why do I need this test? Not because I'm getting older. Ask what specific medical question the test is answering. Question 2, what are the possible downsides? Could it cause anxiety, false positives, additional procedures, radiation, complications? Question 3, what happens if the result is abnormal? This is one of the most important questions, because you need to understand the next step before you take the first step. Question 4, will the result actually change my treatment? If the answer is no, you have a very reasonable reason to ask more questions. Question 5, would you recommend this test if I were your parent? Now, I'm not saying your doctor should literally make the decision based on their parent, but this question can sometimes open up a very honest conversation. You might hear, yes, absolutely, or honestly, given your situation, I'm not sure it's necessary. That conversation is valuable. The real danger after 60. Here's what I think is the biggest danger. It's not testing, it's not avoiding testing. It's automatic medicine. Doing something simply because that's what we always do. Getting another scan because, why not? Taking another test because it can't hurt. Actually, sometimes it can. Choosing wisely was created specifically to encourage conversations between patients and clinicians about which tests and procedures are necessary and which may not be. And that doesn't make you anti-doctor. It makes you an informed patient. One story to remember. Let me give you a simple scenario. Imagine you're 72. You feel healthy. You walk every morning. You spend time with your grandchildren. Your blood pressure is controlled. You have no unusual symptoms. At your appointment, someone suggests an additional test. You could simply say, okay. Or you could say, before I do it, can you explain what you're looking for? The doctor explains. Then you ask, if it's abnormal, what happens next? They explain. Then, and if it's normal, will anything change? Now you understand the entire pathway. Maybe the test turns out to be completely reasonable. Great, get it. But maybe you discover that the test isn't likely to change anything. Now you've had an important conversation. That's the difference between being a passive patient and being an informed patient. The final message. After 60, your health strategy shouldn't be, find everything that's wrong with me. It should be, find the things that matter. There's a huge difference. Because every test comes with a question. And before you agree to the test, you deserve to know what that question is. You deserve to understand the possible benefits. You deserve to understand the possible harms. And you deserve to know what happens next. So let's go through our 5 one final time. Number 5, whole body scans without a clear medical reason. Number 4, continuing age-sensitive screening automatically just because you've always done it. Number 3, routine screening for conditions when you're asymptomatic and the evidence of benefit is uncertain. Number 2, panicking over or automatically escalating a mildly abnormal laboratory result without understanding its significance. And number 1, PSA screening after 70 without an individualized discussion of benefits and harms. Remember, these are not universal never rules. Your medical history can completely change the answer. Symptoms can completely change the answer. Risk factors can completely change the answer. And your doctor may have a very good reason for recommending a test. So don't take this video and cancel your next appointment. Take this video to your next appointment and ask better questions. Because the smartest patient isn't the person who gets every test, and it's not the person who refuses every test. The smartest patient is the person who understands why the test is being done. If you found this video useful, share it with someone over 60, because sometimes the best health advice isn't do more. Sometimes it's understand first. And remember, your goal isn't simply to live longer. Your goal is to stay independent, stay active, stay mentally sharp, and enjoy the years you've worked so hard to reach. Take care of yourself, and I'll see you in the next video.